You know, Governor Andrew Cuomo joins us from his New York City office. Governor, good morning.
Good morning, Charlie. We have to stop meeting like this.
Yes, we did an interview a couple of weeks ago. And in that interview, you said to me there are two aspects of this. Number one is the public health question. Number two is the panic and anxiety question. So this day, now that we have a patient here in New York City, what troubles you the most? What worries you the most?
It would be the anxiety, if anything, Charlie, because as we discussed at that time, we had an advantage here in New York. Most cities did. We watched what happened in Dallas. And Dallas, in many ways, was at a disadvantage because they were the case of first impression. And we have been preparing for weeks and weeks, literally. We did a training session the other day. We had 5,000 healthcare workers. So our healthcare workers feel trained, they feel prepared, they have the equipment, we did the drills. Everything that happened here, by the way, was a textbook case of how the situation should be handled. We know more about the disease, we know how the disease is transmitted. So everything that could have been done and should have been done has been done, and it's been done properly. We have the CDC on site. President Obama called last night, asked if we needed anything else. We identified 8 hospitals in the state that if a case presented itself, these 8 hospitals will be fully prepared. Bellevue was one of those 8 hospitals, and it worked. This was also a doctor, by the way, so he was familiar with how to handle it.
You know, Governor, I was going to say that is one of the fortunate things is this was a doctor, Dr. Spencer, who was taking his temperature twice a day. He knew immediately how to alert authorities and handle this in a safe way. I think the question, though, many people are asking, Dr. Spencer, though, just the night before he was diagnosed, he was riding the subways. He had been in an Uber taxi. He went bowling. Can you assure people that they are not in a perilous position?
Well, what the doctor knew was this is not like the flu or a common cold. It's not contagious until you're symptomatic. And the more ill you become, the more contagious it is. The doctor presented himself at the hospital. As you mentioned, he was taking his temperature twice a day. He presented himself at the hospital when he had a temperature of 100.3. It's been reported that he had a 103 temperature. It wasn't 103. It was 100.3. So as soon as he felt the fever coming on, he presented himself at Bellevue. And from there, all the proper protocols were handled. And again, he was only really in the company of 3 people. His fiancée, 2 co-workers who were also, he went bowling with, and he took a car service ride. So from his point of view, I would assume he would say, as soon as he had a slight fever, he presented himself to the hospital.
All right, Governor Cuomo, thanks.